Diane Martindale, this year's president. The league is pleased to be here, and we want to thank those people who made it possible, Sarah Crosby and Key Bank. The League of Women Voters does not endorse candidates or political parties, but does encourage informed and active civic engagement. We work to increase understanding of major public policy issues, influence public policy through education and advocacy, and do take stands on issues after study and consensus. Is anybody here today a newcomer, just to the League's meetings? Okay, we have membership information over there. We have a donation basket. I'll just kind of tighten that up.
Oh, our hands are out towards you, kiddo.
That's okay. She was too shy. Today is the last day for comments on the Kinder Morgan Canadian coal transport. So if you haven't gone through the first step, today's your last chance.
Actually, it's over at noon.
Oh, Ann is here. Good. I didn't see you, Ann. I was going to say, Ann, would you like to make any other comments on that?
Well, it's just that the application for being a commenter is over at noon.
At noon? Oh, well,
It's time.
never mind. Never mind.
However, the league did make an application
We
to
did,
be commenter.
and worked hard on that. So if anybody would like just details about what Ann did on behalf of the league, she slaved over it, so she's going to be able to address the details better than I. At our March meeting on the 10th at the library, we'll be working on the national consensus topic on agriculture. Please go to the state Washington site to do your background reading beforehand. This is why many of us joined the league, to be really informed on issues, and this will go in depth. Boyd Pratt will guide the discussion, and all members are invited. Please feel free to invite non-members who are interested in seeing how the league works on these issues and arrives at their positions. In April, we will have a renowned and lively speaker on climate change issues. More news later from Sarah and others. And mark your calendars now for the May membership luncheon on the 12th. With that, I'd like to introduce our programs chair, Sarah, who is responsible for our great programs. Thank you.
And I too thank you all for coming today. This is our February membership meeting, and it's entitled The State of Our Health in San Juan County. Our speaker for today is Dr. Frank James, who is the health officer for this county, a position he has held for the last 21 years. In addition to his work on our behalf, Dr. James holds the same position for the Nooksack Indian Nation, as well as being a clinical assistant professor at the University of Washington School of Public Health. Currently, Dr. James is also helping to organize a group of Whatcom County doctors who are working on a scientific evaluation of the health impacts of the proposed coal port and coal trains, which have the potential to affect the health of all of us in the Northwest. According to the revised Code of Washington, among the duties of a health officer is to be responsible for controlling and preventing the spread of any dangerous, contagious, or infectious diseases that may occur within his or her jurisdiction. He is also responsible for informing the public as to the causes, nature, prevention of disease and disability within his jurisdiction. One other of his responsibilities is to inspect, as necessary, expansion or modification of existing public water systems and the construction of new public water systems. He or she must also assure that the expansion, modification, or construction conforms to system design and to plans. As you can see, Dr. James is both accomplished in his field and involved in a very direct way in the health of our island community. We look forward now to hearing what he has to say about current or potential health threats to islanders, and to hearing any suggestions he might have about how we can protect ourselves or adjust to the realities that we face. And now I give you Dr. James, who will give us his thoughts, and then we'll open the floor to your questions.
Good afternoon, everyone. I'm used to showing slides, and actually I had a slide show prepared, and I asked the staff people to maybe bring over a projector if we need it. But I can talk too. So the good news about San Juan, and it's very good news, is that San Juan is easily the healthiest county in the state of Washington, very likely the healthiest county in the United States. And that falls from a number of very clear factors. People who are at the longest, if you start at age 20, which takes out some of the noise in the system, people have the longest life expectancy of any county in the state, and have for some time. If you look at that in more detail, what you find out is that not only is that true, but they're the antecedent factors you would expect to be positive. They are the most physically active population in the state. So when we measure physical activity, both teens, middle-aged people and elders, all are more physically active than those same populations in other counties in the state. They are the least overweight. We have the lowest rate of obesity in the state of Washington. We have the best nutrition. If you do surveys about people consuming 5 fruits and vegetables every day, we have the highest rate of people consuming healthy food in the state. Now, there isn't good data that's comparable nationally, but recently there's a place called the Institute for Health Metrics and Evaluation in Seattle, and they're the place that Bill Gates gave $100 million to study health. And they contacted me because we're an outlier. We're healthier not only in the state, but in the nation. Here we have good, clean standards that we can measure in a systematic fashion. Oh, thank you, Lane. It's perfect. No worries. So I may show you some of this just because I think some of the stuff works better seeing it than just hearing it, because there's nice little graphs and numbers and all that stuff. But to finish up on this first thought is that we also, for example, have the fewest diabetics of any county in the state. So those are all things that lead to that conclusion that we have the longest life expectancy, and there are lots of those antecedent things that you would expect, exercise and diet, which are largely what determine our health status. We're actually better than other counties, not the best, but better than other counties in a range of other things. Protecting elders from influenza. We have the highest immunization rate of elders. Higher, not the highest, but higher than most other counties. Fewer young women with STDs, less teen drinking, more teen physical activity, fewer pregnant moms who smoke, and low birth weight infants are very rare. So we're better than other counties on average there. Not the very top, but better than other average. We're sort of average in a number of things. And when we hit average, I think that's a place to improve, right? So our adult cigarette smoking and teen cigarette smoking are average for the state. Tobacco use is the leading cause of preventable death in the United States. About 450,000 excess premature deaths in our country. And so it's one of the low-hanging fruits. That's something we can change. We have some places that routinely violate the law about selling cigarettes to minors, for example, and I routinely make it a habit of stopping in there and talking to them. And eventually they can lose their license if they persist. So there's a kind of there are small things like that. But it's become increasingly true that smoking is kind of on the way out. And that's something we can certainly continue to work on. Some of the changes that happened by having a hospital here have been very interesting changes. Some for the better, some not for the better. I think when people looked at the new hospital, they all said, we want an emergency room, we want a hospital in our community. And the people came together and brought in about $10 million to make that happen. It is very admirable. But there's a downside, and I actually spoke out about that downside to start with, and it's proven to be true. And that is, those are very expensive things to have. And we don't have the volume that makes them more cost-effective than other regions, so it's more expensive in other places. It came up fairly recently where a gentleman went in with a laceration on his leg. In the olden days, everybody would have dropped everything, they would have brought him in on a gurney, they would have sewed it up, and it would have been a $180 bill. But in an emergency room, with all the ways the fees work and the way the system works, is a $6,000 bill. And so, yes, there's better care, but there's a significant price for that care. And the prices for everybody for everything went up. So it's great to have access to that level of care. You know, it beats having to be flown in a helicopter someplace. And the quality of the providers there is outstanding. But it's really, we're going to suffer, I think, a disproportionate impact because it's going to amplify the disparity of people with money and people without money. It's going to be harder for people with lower incomes to get adequate access to care. There is sort of a humorous underside to this, because the other thing that comes up in the data is that we're deficient in some things. And two things we're literally at the bottom in the state is people with insurance. We have one of the least insured populations in the state. And the second thing is people with a primary care provider. We're at the very bottom of the heap on people with a primary care provider. Now the interesting thing, as a physician, it's a little humbling here to hear that. You know why? We have the highest health status and the worst access to health care. That tells you something. And as a public health person, I've always known it's true, but many of my medical colleagues don't know it or believe it. And that is that doctors and nurses and hospitals have very little to do with health status. We have a lot to do with disease. When disease happens, we're on it. But health doesn't come from doctors and nurses and hospitals. It comes from the choices people make every day about what they eat, about what they do in terms of exercise, about the habits they have. That's the real source of health. It's not what many people think and assume it is. Something I do with people at times is I have them make a health map. I have them get out a piece of paper and they draw a map of the health, their own health. And what's interesting, you do with college students are the most accurate. They put their bicycle and they put their parents and they put, you know, the things that they do for fun and they got it right. And over in the corner there's usually a doctor or a hospital or a clinic or something that's really unimportant. And that's really very, very accurate. We're, as physicians and healthcare systems, we're really important when there's disease. But we're not what causes health at all. Not even close. And I think the data about our county really exemplifies that. You know, low rates of primary care provider, low rates of being insured, and hence the access issue, and yet the highest health status. And when we measure the antecedent causes, we find out people exercise more, people eat more fruits and vegetables, and that's an interesting thing. Now, there's one other area where we don't do well, and I struggle with what to do about that. And probably the other area where we're kind of an outlier statewide and in the wrong direction is adult binge drinking. Some of you, binge drinking. And binge drinking is defined as 5 or more drinks at one sitting. There are a lot of people that retire here, and often one of the spouses passes away and the other spouse is left alone, and it's a very isolating place. And I've had encounters with many people that drink too much, and what they say is, "I drink at home, I'm not hurting anybody, and it's none of your business, doctor." Well, it's a hard issue, isn't it? I work with our senior folks because they're on our health team, and the senior folks kind of told me that too. You know, that's the same thing they tell me. That's what I was told. So it's a funny thing. Now we know that alcohol does impair people's life expectancy, and the sad thing about alcohol often is that people kill other folks because they drive their cars. So I think it's an area that's more complex than it seems to be at first blush. I know I became aware of this probably 10 years ago. And honestly, sincerely do not know what to do. Because many of the cases are people who don't drive cars, and the only person they're harming is themselves. And it's the public health piece isn't so much there. It's a choice people make. And alcohol, of course, is mixed. You know, I have really bad high cholesterol. My dad had his first heart attack at 40. I'm on maximum medical therapy. I've got the highest dose of statin you can take. And my doctor sat me down and says, Frank, you're going to have to drink 3 ounces of red wine every night. And at first I thought he was joking. I realized he's serious. And I'm never drunk. You know, you scrape so many people off the pavement, it becomes not a fun thing to do. So at 62 years of age, I was drinking 3 ounces of red wine every night. And I bought the really cheap stuff because it was medicine, right? My sisters, her and her husband are quite successful in business. They brought me, when they found that out, they brought me 4 bottles of the kind of $100 bottle variety. And I discovered, oh, this can taste good. And then one night I had the experience of, I had my 3 ounces and there was some left in the bottle. I thought, well, I should just get rid of it. So and it was a full glass of wine in addition to my 3 ounces. And I drank that. That night I was laying in bed thinking, damn, I had a really good time tonight. This is really fun. And eventually a light bulb goes on. This is why people drink. I'm 62 years old. So I know that it's a mixed deal. I know that there's and even when you look at heart disease risk, there's a benefit. I mean, it's a J-shaped curve. It's not what you think it would be. People that don't drink at all have a higher risk of diabetes and a higher risk of heart attacks. And then when they drink one drink, it goes down to the lowest part, and then as soon as they drink 2 or 3, it skyrockets. So it's a very complicated thing. It's very complicated. But it is one of the issues that is, I think, a problem. In some, I still think it's a problem. And honestly, one of the reasons I mentioned it to you is I don't know what to do about it. And I've been down the road a ways, and I've worked with the folks that run our senior centers, and I've talked to other people, and I really don't know what to do about it. I think maybe it's a case-by-case basis, and you have to reach out to people. I mean, certainly in stopping drinking, what works is family interventions. If people are willing to say, if this is a problem to the other person, this is a problem for me, that you do that. That seems to be what's very effective in stopping. So now I'm going to just stop for 1 second, because some of this stuff just works better in slides. So forgive me for 1 second while I put this thing together.
You have a Mac.
Pardon me?
You have a Mac. You can use it.
Oh, okay. Yeah.
Mac uses.
Now I just had to figure out how to plug it in. Yeah, Macs are a mixed blessing, I'll tell you. It's like this cord that I'm plugging in here. It's universal, everybody uses it. But with Macs, you have to have an adapter. Any questions about what I can say so far? See the answer to questions.
Anybody have any questions?
Or any comments?
Well, I'd like to ask, I've heard that the immunization of children is the lowest in the state in our county. Is that true?
Actually, I'm getting to that, and the reality is it's worse than that.
Oh, really?
Yeah, we may in fact be the worst, one of the worst in the nation. There was a time when we were the worst in the nation. As a public health person, I am ashamed to say that there have been 2 articles in the New England Journal of Medicine, which is the most prestigious journal in the world, both of which highlighted us an example of what's wrong with immunization. Now, that's not something that's new to us. That's something that we know about, and I'll talk more about that. I've got some information about it, specific information. I can show you some slides and show you numbers and all that stuff, and try to get this to work. But what I can tell you about it is that we, with the support of the county commissioners, authorized spending a fair amount of money, and I sent our nurses door to door to every single unimmunized family in the county, 100%. In a small place, you can do that. In a big system, you could never do that. And we found out something that was very, very interesting. I had assumed that it was a kind of a fixed belief system that people have about not trusting or believing in vaccination. And when we went door to door to every single person, what we found out was that's true about half the time. And the other half the time, the people live such disorganized lives that they don't have time to make that a priority. We all live pretty normal lives, but there are people out there that are running from the law, that don't know where their next money for food is going to come from, that don't have housing. And so about half of our unimmunized kids were actually living in households that were just simply super dysfunctional. And the other half there's this group of people that have a fixed belief system that thinks that vaccines are going to harm them or their children, and they feel like they're protecting their family by not vaccinating. And I talk with those groups. I go out and do outreach with them, and the thing that I typically encounter is that they're always shocked because I say there are vaccines that are worth getting and vaccines that aren't worth getting. There's lots of vaccines you don't need. And since I do international travel, I can tell them all about the vaccines where the risk-benefit is really tight. Yellow fever causes, once you're 60, you got to think 3 times about getting yellow fever vaccine. For younger people, it's 100% effective, it's very safe. So you have to tailor it to people. If somebody asks me about polio vaccine, honestly, the risk-benefit is probably in favor of not getting it, unless you leave the country. Because it's been effectively eliminated in the United States, so there is no risk of the disease. But if that same person is going to Africa, they would be insane not to be vaccinated against polio. One family that was adamant against not vaccinating decided to take their kids to Africa for an extended period of time. And after we had the full discussion, one of their children got 8 immunizations, 2 in each extremity at one time, because it sunk in. This is not a joke. The one that's most misunderstood is actually measles. We think of measles as spots of the fever, right? Because we don't have it now. Where measles spreads rapidly, where it's still abundant, 1 in 250 people that get it die dead, and there's nothing medicine can do about it. And people need to know that there isn't measles here, because we've eliminated it. But if they go to some place like Africa or India, there's real risk. And measles is a fabulous virus. If someone was in here breathing 2 hours ago, just breathing, and left and had measles, and you were susceptible, and you came in here and just were breathing, you would get measles. It's a great virus. It is super effective at spreading the stuff. And 1 in 250 people will die. And once they've got it, there's nothing medicine to do about it. Yeah.
Are you finished? I didn't want to interrupt. But
Sure.
To what extent do you think that the positive statistics you cited earlier about the health of our county are skewed one way or the other by the fact that we have a lot of older retirees that have come here usually have had access to health care and good education, et cetera, that probably skew a little bit what their lifestyle is when they get here? And also the fact that a lot of people go off island for
What a smart guy, yeah.
health.
Those are 2 things. So there are 2 confounding variables. One is that, well, and there's a bigger one, is you have to be rich to live here for the most part. You look at
What? I'm sorry?
You have to be rich for the most part to live here. So the 2 things that predict health outcomes more accurately than most other things are educational statement and income. And we're kind of off the scale on both those things. So I actually have a graduate student right now working on doing statistical analysis to tease out exactly those things. Is it the fruits and vegetables and exercise, or which better predicts the outcome, the fruits and vegetables and exercise, or the income and education? And they're interdependent, so doing that statistical analysis is very complicated. And the thing that the Institute of Health Measures and Evaluation wanted to do was to look at us in the late, and to do a study of not just of a little tiny place like us, but the whole country. So we're going to try to work out the methods on this population and then apply that to the whole data set, because they've got data for every county in the United States, and sort out exactly some of those issues. There are confounding variables. And the last one you mentioned, I think, is a really important one, is that people, when they get sick, tend to move off the island. If you're really sick, you don't stay here. We're anomalous in many, many ways. We have about a dozen practicing docs in the islands. And when we were worried about a pandemic, I went and I got the list of all the licensed docs, because I wanted to know who they all were. How many licensed physicians do you think we have that live here, that maintain a current license? Over 90. Yeah. Some of them, some of the most prominent physicians in the world. And there's really famous people that are here that I had no idea lived here. And for some reason, and they often practice in California. There are people that commute, of course. And there's some people that just, for some reason, they use this as their primary address even though they have 3 homes. So we're outliers in many, many ways. And it's hard to, that kind of data really has to be explained in more detail. Here's some of the things that I was hoping to show you. Let me see if I can even get it sort of.
Can you focus it a teeny bit?
I can try.
Okay.
That better?
Oops.
Still. There we go, okay. So, there can be intervening variables for sure, as the gentleman pointed out. But this is what it looks like for life expectancy. This is the amount that it might be different by chance alone. This is a confidence interval. But even with that confidence interval, you can see clearly longer life expectancy than the other populations in the county. In the state. Diabetes, basically the same thing. You can see there's a bigger confidence interval because there's a smaller number of people. But San Juan's at the top there. So we have the fewest diabetics. Here's the data on overweight. We have the fewest people that are overweight in the county and the state. Here's the data about people eating 5 fruits and vegetables a day. And so this is based on real data. And we did a random sample of people in the county and did the Bellingham call, as they did all the other counties in the state.
Excuse me, could you go back to the very first of these
Sure.
slides and read the top 4?
The top 4 counties?
Yeah.
San Juan, Wacom.
San Juan, Whitman, Island, and Seattle King.
Oh.
Whitman.
Yeah, Whitman.
And the
Whitman is on the
last
east side, yeah.
is
It's a university town. County.
Eastern Washington.
Yeah, Whatcom is, Whatcom's right here. It's a little further down.
What are the worst ones down the bottom?
Wahkiakum, Grays Harbor, Northeast Tri-Counties, those are very poor, very small counties. So if you did this against income, you'd find that it almost fits with income. And it almost fits with education as well.
Look at Tacoma in the center there.
Yep, there are ones that are smack dab in Tacoma Pierce is right here.
I can't tell what the actual life expectancy is at the top and at the bottom. What's the difference between the worst and the best?
So
The number of years.
Number of years.
So this is, it's probably, these are 10-year increments, so it's about 4 or 5 years, something like that. And you're aggregating a bunch of data, so that's the, okay.
Thank you.
Yep, and there's the diabetes and the overweight, the fruits and vegetables you can see. And then adult physical activity, again, higher. And then binge drinking, you can see that we got a pretty big number. Not the very bottom, but towards the bottom. And adults with health insurance, you can see we're at the very bottom of that. And adults with a personal health care provider, we're towards the very bottom of that. We're fourth. Adults with unmet medical need. And our flu, our immunization rates are among the highest. Now, here's the data about immunizations. The San Juan is blue and the Washington State is red, and so you can see basically that we have roughly, fairly consistently, about double the exemptions. These are people that say we don't want to get, we're not going to. It turns out in many states, down south, they have almost 100% immunization rates there because they don't allow exemptions, period. If you've had an allergic reaction to the vaccine, you don't get it. Otherwise, to go to school, you have to be immunized. Other states have kind of religious exemptions. People that belong to a religion that forbids it, they use that. Our state has both of those, of course, and one called a personal exemption, where the parent just decides they don't want it. My experience has been, in some schools, it hinges not on what the school policy is or what the county policy is, it hinges on what the secretary that meets the new student says. Because that secretary can say, oh, come on on into school, just sign this exemption form, or they say, you really need to be immunized, and if they really don't want it, then they need an immunization form. But that attitude and how that secretary handles that encounter is very, very important in immunization rates. Because what parent wouldn't want to do what's easy? That happens all the time. And so I worked as hard as I can with the superintendents and with the principals to work to then get to those secretaries. At first we thought we could just talk to the superintendent and we're all happy, right? No. They all have the right policies in place. Talk to the principal, didn't help. It's really that person that meets and greets the kid on the first day. And typically that's a secretary in the office. And so we've learned, and you can measure the differences in the communities based on that factor. If that person does not believe in immunizations or just does what's easy instead of what's right, then you got a problem. And so we try to address that. That's not it's an old thing. We've had that issue identified for a number of years. Yeah.
Well, we understand that if children aren't immunized, they're more at risk of catching whatever disease. But because they're not immunized, are there any other consequences for the rest of us?
Sure. No vaccine, very few vaccines are 100% effective. Okay, so yellow fever is as close as it gets. Most others are 70, 80, 90, somewhere in there depending on the vaccine. Measles, we had a one booster dose requirement, and that was 95% effective. We thought that's pretty good. But because measles is such a great virus, you still had outbreaks because 95% wasn't good enough. Now others where they're not as good at getting around, 95% provides herd immunity, provides community immunity so that other people don't get it. So the consequence can be, for example, with pertussis or even with chickenpox or those sorts of things. We routinely deal with this. When there is a case in a school, that's fine. When there's an outbreak in the school, when there's a number of cases, then the kids that are not immunized are excluded from school. And for things like chickenpox, that can be for 3 weeks. That can be 21 days after the last active case. And so those kids can be highly impacted in terms of their ability to learn if they're basically out of school for at least 3 weeks and often more like a month or a month and a half. Now the reason for that is that there are people that did everything they could to protect them and their children. You know, they did it. But that child that's coming there knowing that they could spread that disease to kids, to other kids, that's what's not okay. That's where you go from personal responsibility to kind of to really needing community immunity as a protection. Yes, sir.
What is it, if you exclude the people that are just simply too busy to have their kids immunized, and you move to the group that has a belief that something's not right?
System, yeah.
What is it that they're believing about immunizations
Well,
that keeps them from it?
You kind of touched on the cutting edge of where research is about this right now. It turns out that there is a culture that develops locally where young moms go around and share their beliefs with other young moms. And when that culture becomes established with information that vaccines harm you, or vaccines are somehow ineffective, or that the science behind it is fictitious, that stuff gets to be part of a culture. And one of the things that's happened in our community is that's become part of a subculture in our community. There are certainly groups of people that have firm and fixed beliefs that I personally don't believe are based in fact about the harms. Now, the problem is there are real harms from vaccines. I mean, the reason, none of these things are ever just made up. Let's talk for a specific example about the pertussis vaccine. An earlier version of the pertussis vaccine had a side effect of causing high fevers and episodes of crying, this really high-pitched crying. It was very typical. It was a vaccine reaction. There's no question that it was. And then there was a potential association that was positive between neurologic effects from the vaccine, which was proven definitively not to be the case. But because that symptom was there, and that at one point that information was considered that it might cause neurologic problems. And this is science. You have to ask the question and answer it. You can't just think that vaccines are good. There are vaccines that are bad. and you have to sort out the difference. Suffice to say, it became widely believed that pertussis vaccine was problematic, and because it caused symptoms in a fair number of kids, it became very common for people not to vaccinate against it. A very significant minority, probably 30% of people, were not vaccinated. Then they developed a new vaccine, the acellular pertussis vaccine, and the side effect thing went away entirely. Doesn't happen anymore. You don't get the fever, you don't get the cramp, it's gone. And definitive proof came that it is not associated with those neurologic events. But that belief is still in the community. And if people don't trust government, don't trust authoritarians, don't trust men, I mean, there's a lot of real things that are there for sometimes very good reasons. But that comes together with that residual information, and then you get these fixed belief systems in the community. That's the best I can do to explain. Yes, sir. Excuse me. This lady in the back has been very, very
I think
patient.
that some people, or younger people, feel that their child might become autistic if they have the vaccine. I've heard that one.
That's right. It's a commonly held belief. Because, autism is a really tough thing. When I was in my training, which is a long time ago now, I'm getting my gray hair too, autism was a kid that could not communicate with the world, and they were clearly, visibly autistic. And what's happened over the past 30 years is autism has become a spectrum. And kind of communication problems in general have gotten kind of put in on that autism spectrum. So autism has both become more commonly diagnosed because the definition of it has changed some, but also, and I've looked at this data many, many times, autism is becoming more prevalent in the community. Independent of that, it's actually becoming more common. And honestly, nobody knows why. And so it's been positive that it was related to autism. That question has probably been one of the most thoroughly researched in modern medicine. Many, many studies with large, large numbers of people. And what those studies consistently show is there is not a connection between autism and immunizations. Now, people choose not to believe that. All you can do is invite them to look at the data. Unfortunately, scientific data is complicated. It's not easy. I mean, I'm a well-trained scientist. I'm a well-trained doctor. I teach at a university. It's hard for me to understand. And so, for especially some of people that have emotional reasons to not trust doctors, to not trust authority figures, to not trust the government. And those are all not entirely unfounded in reality. The government's done some bad things. Men have done bad things to women. Doctors have sometimes been prostitutes for money. I mean, there's no question about it. Those things happen. And so the question is that it gets generalized in a way that prevents people from protecting their children. And that's the heartbreaking thing. Just say, this guy was very patient as well.
Yeah. Wasn't there an incident several years ago where the vaccine was shipped out in a huge batch rather than individual doses, and the batch was contaminated?
Yeah, there are problems like that all the time. I mean, any large industrial process is going to have problems periodically. And we do as good a job as we can to prevent those problems. Now, it's all about relative risk. So people will take, that's a really good example where contamination does happen, or people manufacture things below the standard. It's a lot less common here. It's very common in places like India. In India, it happens all the time. I mean, you don't trust, it's such now that I tell anybody going to India, take all of your own medicines with you, because you can't trust what you buy there at all. Here, we've got really strict laws about it. And so if there is a problem identified, it's corrected quickly. And people make mistakes. Probably once a year, our nurses our nurses are the best nurses on the planet, not just in my country. But once a year, they will make a mistake giving an immunization. They will give the wrong kind, they will give the wrong, some mistake. And when mistakes happen, you have to fix them as best you can. You got to first cop to it. You got to absolutely tell everybody everything the truth, and then you got to get down the path of making it right. And generally, we can. So that's going to be true of any process. But yeah, there are problems, and there are also One of the worst things happened, I think, recently is that a very well-meaning pediatrician who said something that was absolutely true. They've been adding a preservative to vaccines, and that preservative had mercury in it, in super small amounts. And not the kind, there's ethyl and methylmercury, and it wasn't the kind known to cause problems. But our rules said mercury. And what had happened is over time they kept adding more vaccines, and this well-meaning pediatrician added it all up and said, wait, if we fully vaccinate kids, they get more mercury than our own standard says is safe. Now, what was horrifying to me was to watch what happened, because that man, who was not an anti-vaccine zealot, he was a rational, reasonable person doing his job, who discovered something that should have informed us and we should have corrected reasonably and rationally. The backlash against him was unbearable. I mean, and he was right. It was horrible. It broke my heart. Intellectually and my soul was hurt by that. Because this guy was not trying to do harm to anybody. He pointed out something, and he was right. And yet there was a huge backlash against him personally by the people promoting vaccine. And what they thought was this is going to really hurt the acceptance of vaccine and do a great deal of harm. And they were probably right about that. But you don't go back and say horrible things about the person when in fact it wasn't justified. So it is not simple. This is complicated stuff. And people do make mistakes. A whole country full of really smart people didn't do that math. And when he did, it was super embarrassing, and there was a big backlash against him that was totally unwarranted. So you look at things like that, and then you understand why people do have these feelings, you know? There is sort of a conspiracy to vaccinate kids, and I think it's a good one because it works. But if you push back, there can be consequences. It was a very sobering and humbling experience for me to watch that, because you just want to stand up and scream at people. Yes, sir.
Go ahead, she was first.
Oh, yeah.
Yeah, I'm a neonatal nurse, so I work with parents a lot of whom walk right into the nursery against vaccines. And I think that sometimes people hang on to that in spite of the scientific studies, because autism is so frightening. And there isn't anyone who can say, here's what causes it. So to grab onto something that they consider concrete, oh, well, it's the vaccines.
Yeah.
I think it's very hard to let go of that for some of them, because
Absolutely.
there isn't any other answer.
Right. I mean, and the ADHD is another thing.
Right.
You know, that really is objectively increasing in our society, and there's a lot of different approaches to it. You know, some people medicate. I personally wouldn't do that, but people do, and so there are changes going on that we don't. Honestly, we have no idea what's causing autism, and we have no idea what's happening with ADHD. So, and you're right, people generalize. They want to protect their child from something they see. And they pick what they can understand.
Right.
Not necessarily.
What they think they understand.
That's right, yeah. Well, yeah, exactly. Yes, sir?
I assume that some of these immunization programs are implemented through the schools. Is that a correct assumption?
No,
Or is
it's
it
not.
just, it's not, okay. So it's with,
The way it works is that the way the states, in almost all the states in the United States, and it's a state level thing, not a federal thing, and not a county thing. The states who make rules about that, that's just the way our legal system works. And what they do is they say that immunizations are a requirement for school entry, and that's to protect the other kids that are there. So that's the only connection with schools.
So the actual immunizations are not done at the school, basically.
Okay. Rarely, in an outbreak situation, for example, there was a case of chicken pox on Orcas recently, and we actually sent our nurses over to, and a bunch of people that had been immunization hesitant, when they realized they had to keep their kid out of school for 3 weeks, became less. All of them, I think all but one got their kids immunized. So we did send our nurse over with the vaccine and immunize them, because it was a teachable and learnable moment, an immunizable moment.
Well, my follow-up question is still, I think, a valid question. Is there an effort in the schools, for example, to meet with parents, to educate parents, to answer questions by parents, so that they have a better basis and hopefully a more informative basis to make a decision?
It's so interesting because you had exactly the same thought that I had. and then you go to the school district. And let me tell you, I have no greater respect for anybody than the superintendent or principal, because they are low-hanging fruit for everybody. And so, I don't want to hang any more responsibility on them, because they got plenty already. I mean, really, we need to take that on our shoulders, we can't put it on theirs. I mean, could they, should they, sure.
So,
But that's asking something extraordinary of somebody. It's
so
not what you
if there are
think.
parents out there who just learned that their child can't go register for school because he or she doesn't have the necessary vaccination, and they want to discuss with somebody, they're going to have to go to you, to the health department, and then it sounds like, to say, you know, I've got a tough decision I got to make. What do you say?
Most people have primary care providers.
Yeah.
You know, I mean, just so you know, our health department and all health departments in this country have been cut by probably 50% in their budget. We've been a little more protected here because we got that levy lift that saved our hind ends. The average health department in Washington State had a 50% reduction in budget and more than a 50% reduction in staffing in the past 5 years. And we lost staff. We, like I say, our community stepped forward and supported us, and I hope they do again. But other communities, they don't have the infrastructure capacity. But most people go to their primary care providers. I mean, something I did back 20 years ago when I took the job as a health officer for Whatcom County, is I looked at what we were immunizing people, and I stopped our immunization program. Because what I did is I took that money and I bought vaccine, and I gave it away to all the doctors in town. I made a deal with them. I said, I'll give you free vaccine, because they didn't like having to deny vaccine to people who couldn't pay for it. So I took all of my budget and bought vaccine with it, and I made a deal with all the docs in the community at the same time that they would offer vaccine for the administrative cost only, about $10. And we'd do the heavy lifting on the cost. They would not charge people, except a minor administrative cost. And we doubled immunization rates in Whatcom County. This is 20 years ago. It's one of the smartest things I've ever done. I will have done more good by that than all the doctoring that I do to interview people for the rest of my life. And in fact, the state has now adopted that system overall. They do that same thing. Kind of health departments are the immunizer of last resort. And really, we try to get people into primary care settings, into having a medical home, and try to give the resource to the primary care provider. So it's actually the primary care provider that should do that, which is another problem for us, because remember I said before, we have a very high rate of not having primary care providers. You've been very patient.
And a very high rate of uninsured. So when you went out to all those homes, and that 50% that were just too busy or too dysfunctional, did you look, I'm sure you also looked at whether or not they had insurance, whether or not they were part of WIC?
We were more ruthless than that. We just immunized.
You did?
Oh, yeah.
Oh, okay.
Oh, if you're bothered to send somebody out, why would you send them without a vaccine? No. We tried to take immediate and direct action. Direct action is not always a bad thing. Not always people in the street. But no, yeah, we tried to, and our rates have improved substantially since those days. We're no longer the laughing stock of the country or even the state. We're much, much better. Some of that badness was also the way they counted things. Like the reason we popped up at the national level was they took the data at a point in time before a lot of our data came in, and that's just the way the national data sets work. It didn't coincide with ours, so one of the reasons that we were there in such broad and stark relief was actually data, not how they collect the data, not real. And we still are plenty bad enough, and we still should do better than what we've done now. No question about it. Let's go on to a few more things. This is just the percentages.
You have a question over here.
Yeah. Okay. Yes, sir.
I was just going to comment that your statistics on insurance have to have changed in the past few months because of the
We
health care.
haven't collected data in the
Yeah,
last 2 months.
you need to collect that
Yeah.
because I know lots of people that now have
Right.
health insurance that didn't have it.
And the thing that gets, people get misled about that in general is that what changed dramatically with the Affordable Care Act was actually Medicaid people who qualify for Medicaid got dramatic increase. I mean, 6 million people, boom, like that, now had insurance that never did before. And the states that, there's data about the states that didn't, because some states said we're not doing that. And there's actually data on the mortality rate in those states being higher. That decision killed people. So you're right. This is old data compared to what's currently available. And, you know, I'll just share my opinion with you. We need a single payer system in our country, period. End of discussion. Well, what we've done is we kind of took a moderate Republican program and implemented it because we could do that politically, but it doesn't, the real savings, the real advantage financially is that 25% of funding that goes to insurance companies to manage these things. 25% is a huge amount of money when you look at our budget. And if you redirect that into care, I mean, Canadians love to complain about their system. None of them would try it for ours. The British love to complain about their system. They spend 25% of what we spend on healthcare. I never thought about it, but what we spend on insurance is all that they spend totally. And they have better health outcomes than we do. Everybody has better health outcomes than we do. And it's, interestingly, I don't know how many of you know John Guyman, but John Guyman is a national leader on that topic, and he still publishes a book every year on a variety of topics, but he's an extraordinary intellect right here in San Juan. But yeah, that will all change. How it will change, I don't think anybody knows. It's definitely a huge step in the right direction. It is not the step that I think we really need, but it's a huge step in the right direction. This just is data about all the different counties, so if you want to look with an excruciating detail about what it is. We've got a lot of company on the bottom. Red is bad. Just a little data. This is data we just did because we did a maternal child health review. And we have some comparative data. First, prenatal care, we're doing pretty good with that. About the same as the state average. Breastfeeding at 6 months, we are the rock stars on the planet on that. Our nurses get out there and support breastfeeding like nobody does. 60% is average statewide, we're 85%. Nobody comes close to us. We're probably 15% higher. Our nurses love to do that. I have to drag them off to do infectious disease stuff because they like the maternal child health stuff. Immunizations up to date were a lot worse, as you can see. Not what we should be.
Stunning.
Dental stimulus, we looked at dental care. People belittle dentistry, but actually it's pain. It's not just pain, it's real medical complications, and we're well below the mean there as well. Outcomes, infant mortality, we're a little better than the state on average. Neonatal mortality, we're a little better. Unintended pregnancies, we're a little higher. Not probably significantly different. Here's the other outcomes. Childhood mortality, it looks like we're a little higher, but the confidence interval is a little here because we have such a small population. So we had 2 deaths in that age range out of that many kids. So it's a little higher, but the range, because the number is so small, it's hard to say that that's significant. It's probably not. And most of these, this range over here, this confidence interval, this says this range is so hard that there's really no difference between these two things.
Question?
Yeah.
What are those numbers? It looks like 20.7% of children between 1 and 18 die? I can't.
No.
No. What does that mean?
It's relative to the state. So actually there are 2 out of 9,662 in that age range. Okay, and this is 5 teen birth rate out of 819. So if you want to look at the real numbers, they're right there. And it's not, like I say, it's not too interesting because it's not very different. Newborn screening, there's some things we don't have data about. We don't have good access to a level 3 nursery for very low birth weight infants, but they never get born here anyway. They get born as children. So this is all data that's sort of noisy. Let me talk to you about coal for just a minute, okay? Because people ask about coal.
I did have
So,
a statistic on there about how many kids percentage-wise are on Medicaid.
Yeah.
I just wanted to see that for a second.
Yeah. Let's see. Where was it? You
I thought it
remember?
was just on the...
Was it the previous one? Again, the problem with this is before this year.
Yeah.
So all that's going to change. So I wouldn't even look at this because it will change. And San Juan always has done an extraordinarily good job of embracing things like that. So I expect we're going to shoot up more dramatically than other places. We had a low number. Now there is an access method. I think it's going to shoot up. So I think the rate of change will be higher. So coal. Most people think about coal, they think about the Powder River Basin, they think about this train route, they think about us right here, okay? And there are a bunch of issues that I'll talk about relative to that. But the bigger picture is really, that's this part. It then goes over here and does a lot of other things. So, and the one reason that this is important, just in a selfish way, is deposition of mercury. There's a trade wind that blows this way right here. And so when China and India and Korea and all those people burn the stuff there, and they do that in great amounts, it comes this way. And actually between 15 and 30% of the deposition of mercury, the mercury that comes out of the sky and lands on the ground, is from China. They've done good studies. So we send it over there and they send something back. And you may think that that's sort of theoretical, but my water that I drink every day comes out of Lake Whatcom. Lake Whatcom has more mercury than is safe. Pregnant women, or childbearing age women and kids shouldn't consume fish out of Lake Whatcom. And that's my water supply. Okay, so it's not just a theoretical thing. And native people who eat more fish is something I never say in a native group because I don't know what to do about it. But 17% of Native American women in our state have mercury levels high enough that will impair the intelligence and the coordination of their offspring. That's 1 in 5. So these are not just theoretical things. These are real things that really impact people. The situation in China, it's something close to me. You may not know this, but my wife is Chinese, and half of my family lives in China. And in the past year, my wife's uncle had a stroke and died. The other uncle developed laryngeal cancer and now breathes through a trach and eats through a feeding tube. Her aunt had stomach cancer. That's in the past year.
Are they living here?
No, they live in China. Yeah, they live in China. And recently there was a published article about an 8-year-old developing lung cancer in China. Unprecedented. Now, as much as I like to whine about health, the reality is life expectancy everywhere on this planet has gone up every year for at least 100 years. Everybody lives longer. The only exceptions to that are when there are wars, okay, which we all understand really well. Lead poisoning, bad stuff, right? So, now, there's only one data set that is at variance with that, and that's in China. In the past 10 years, the life expectancy in China has gone down 5.5 years. That's the only place and the only time in the past 100 years where that's true. The pollution is so bad that you can't see from here to the plant outside the window. And some of you may have followed that in the news. It gets on the news periodically, but you know, we measure the number of particles in a cubic meter, and when that number gets to 20, that's kind of where we're at. If that number gets to 100, that's like an emergency. That's an air alert, and people with bronchitis or emphysema or asthma should go inside and lay down. You know, we seldom get numbers like that. The numbers in China, routinely in the large coastal cities like Shanghai and Beijing, reaches 300. That's routine. And lately, it's reached 700, 800, 900. Which honestly is literally incompatible with life. 1.3 billion people being subjected to something that is honestly incompatible with life. It's going to be really interesting to see what happens. The cancer rates, the lung cancer rates are going up, the death rates are going up. It's going to be interesting to see industrialization. They industrialized in about 20 years what it took us 100 years to do. And how they're going to wrestle that is interesting. And it's not the only problem. 50% of the rivers no longer reach the ocean. Well, the Colorado doesn't reach the ocean either. So So the basic math about the facility being proposed at Cherry Point is that they're going to send 18 or more 1.6 mile long trains traveling across the state and through the communities all the way along. About over 400 very large ships will traverse our waterways each year. And they'll bring 48 million tons of coal to Whatcom County and then travel through San Juan County. Over 20 years, that'll be about a billion tons. So why is it a health issue? There's a group of physicians and myself that went, and we didn't know what to think about it. And some of the people that were involved in it were, they thought this might be a really good thing. But they kind of didn't know. So we got together, and a bunch of, I think the majority of the people had a PhD in addition to an MD degree, or about a dozen core people. And so what did we do about this? We went straight to the library. And B, the librarian, got us, we said, we want the medical literature on these issues. And so she came back, and we sorted them into piles, and we divvied them up and reviewed them all. And they, for us to look at them, they had to be published in a referee journal of repute. It had to be a real objective study. This was not, the New York Times or something. And these turned out to be the issues that came forward. Air and water pollution, coal dust and diesel exhaust turned out to be a big deal. Increased train traffic and ship traffic, noise pollution, delays at rail crossings, and this increased traffic. And as we sorted them into piles, we kind of thought they'd be 50-50. We were wrong. They all said whether or not the medical article we looked at would be pro or con, kind of whether they'd be in favor of or against doing what's proposed. But honestly, they were all against it. They all showed evidence for concern. And I think all of us were right, because we're split between, there were Democrats, there were Republicans, there were pro-business guys, and there were, tree-hugging environmentalists in our group. And somebody brought this noise thing, one of the guys, and I said, no one will take us seriously when we talk about noise. No, we're not talking about noise. And he came back with a stack of articles, and I've got to say that it's probably the thing that worries me the most, now that I know about it. Because elders, if you wake up, like for the trains especially, if you wake people up every 2 hours at night, really bad things happen. Cardiac arrhythmias go up, heart attacks go up, strokes go up. Injuries and accidents during the day go up. Kids' learning ability was decreased. I mean, and this is good science. This is not somebody dreaming this stuff up. And that'll happen in every single community along the line. There's going to be a train going every hour of every day, 24/7. I have an elderly neighbor who lives up above me, and I'm maybe a half a mile from the tracks. And he calls me. He says, Frank, I just can't stand it. I want to move, but I'm 78. I can't really move. I can't stand it. But, Yeah, not a good thing. Coal dust is known to cause chronic bronchitis, emphysema, pulmonary fibrosis, environmental contamination through leaching and popping heavy metals. It's got lead, mercury, all kinds of things in it. Noise exposure, I just kind of briefly mentioned it, but...
I have a question for you.
Yes, sir.
Can you go back one?
Sure.
Is there any way to say how much coal dust is going to be spewed by these trains?
There's studies going on to measure that right now. But there are 2 small studies have been done so far, and what they show is that close to the tracks, the measurements were 30 times what is considered safe air quality levels. 4 kilometers away, it was barely measurable. And unfortunately, that was a study done in Canada, and that's all they did. They didn't do the grading in between. There's a guy down at the University of Washington named Jaffe, who's doing a proper study, looking at the proper gradation, and will know probably in 6 months what the real answer is. But there's good science being done with it right now. Interestingly, Burlington Northern Santa Fe has that data. They've collected that data for probably 10 years. Good data takes about 3 years to get because weather impacts it. So they have the data and they're not sharing. They've collected that data for a long, long time. Yeah.
In all fairness to them, I agree with you about this.
Yeah.
They claim that they're going to coat the surface of the coal cars with some kind of sealant to keep the
They are
dust down. I mean, they recognize that this is a concern of the public, and they responded with, in a certain way, with some process, and whether it's effective or not, I don't know. But
Well, no, that's not a new thing, and that wasn't in response to this. So about 5 years ago, BNSF had trouble keeping its trains on the track because the coal dust actually filled up all the spaces around it, and it also caused some problems, structural problems with the tracks itself. And so BNSF actually sued the people who were shipping coal, and so there's a big objective record about this. And BNSF is the very people that made the case for it being a problem. Okay, and some of that data was then made public. And they actually were able to force the shippers to apply the coating, the topping material. That basically is like hairspray, you know, basically like hairspray. And that will reduce by about 85% the amount that comes off. However, it's about half a ton per car that comes off. So
half a ton? In what length of trip?
It's 1,400 miles, 1,700 miles, something like that. It's a long trip. Most of it comes off at the beginning. But there are plenty of videos of the wind hitting trains and having it fly off. In fact, there's currently a court case which will probably come to the real facts about it, where down along the Columbia River, well after they've left Montana and Wyoming, there's major amount of coal, not just dust, but chunks of coal going into the Columbia River, and there's a Clean Water Act court case about that right now. We'll know a lot more when that court case reaches fruition.
And there's some reason why they can't put a cover over the...
Yeah, because Powder River coal is very soft and it breaks, and then they crush it before they put it on so you can fit more in a car, and it rubs against each other and will combust into flame. So if you cover them, they catch fire. And the second thing is an economic reason is that the way they empty them, they pick them up and roll them over. You know, the big machine does that, and they have to redesign the roller and the cars, and that's prohibited. From their point of view, they don't care so much about the person in flame. They care a lot about the expense of having to redesign their cars and the loading and unloading facilities. You know, I thought that about them before, but you're talking about the wealthiest and most powerful people in the world.
And the poorest will be living nearer the track.
Oh, of course, yeah. So Goldman Sachs is just, I love gossip. The best gossip out there right now about this is that Goldman Sachs just sold its share. They had several reports that said that, you know, it doesn't make good economic sense. You know who they sold it to? A nice guy from Mexico who owns ports in Mexico.
Slim.
And one of his jets recently crashed and had 4 tons of cocaine on it. Turns out that he's the number 2 man in the largest drug cartel in Mexico. That leaves you wondering 2 things. One is, are they going to export something besides coal? And because they certainly do on the plains in Mexico. And the second one is, there is a possibility that this stuff is all going to get redirected to Mexico, because if they can't ship it out here and they can't ship it out in Canada, they already have a contract to send it out to Mexico. And there's a deep water port there, and there's going to be no opposition in Mexico like there is here.
Then it's going to go down the
Get it.
Pardon me?
The half ton of coal you said escapes, is that is that without the
That
treatment?
was
or is
without the
With
hairspray covered.
With the treatment, that
Yeah.
what's the percentage?
It's 15% of that. I don't have the math here on me, but it's 15% of 500 pounds.
Still a fair amount. Okay.
Yeah.
Well, we're dying to see what else you have.
So coal dust is an issue, and coal dust honestly is the least problematic. More problematic is the noise piece, and I just talked about, you know, strokes, arrhythmias, ischemic heart disease, cognitive impairment in kids. I mean, not an issue for you guys out here, but a real issue for people in town, and one that is almost impossible to mitigate. Yeah.
Are you sure it isn't an issue? Those ships aren't silent.
Well, for human exposure is not such a big deal. It is a big deal for the animals that live here.
Oh, yeah.
That's a really big deal. So that's the noise on the marine impacts. I'll get to that in a minute.
Okay.
But there are real impacts for marine mammals, because they use that to communicate and to know where they're at. and messing that up is probably not a good idea. Frequent long trains, they delay emergency services, ambulance, fire, police, increased accidents. There, last summer, I think 5 deaths on the railroad. We had one in Bellingham a couple of years ago, there was one in White Rock a few months ago. And when that happens, the people were trespassing, it's their fault. And parenthetically, on the train part, and on the ships too, if they try to stop, these things are not what you think in terms of size. The trains, if they lock all the brakes up, the engineer sees something, locks all the brakes up, it takes a mile for it to stop. That's with every brake on every car engaged. They're that big and that heavy. The ships are interesting. This is our largest ferry. This is how big the ships are going to be. They are the largest moving things that human beings have ever made. They have the worst safety record of any type of ship on the high seas. There's about one of these hauling coal crashing about once a month the last year or so. Yeah.
How come we don't do that?
There's actually a really neat online thing where you can go and you can track things. They're just like there's train spotters, there's ship spotters. You can actually keep track of where they're at. And it's in the news. It's just that we don't get that part of the news.
Actually, it wasn't in the news here when that coal ship in BC
This was.
overshot, the dock. And
Yes.
there was nothing on the news here.
So I've sat with these people and I've had debates with them, and they tell you this is it's safer it's safer than driving to the store. And accidents never happen. This is where this ship went through that. And you can't see it very well, but there's coal all over in here that's spilled. So, yeah, and that was in West Shore just last year. Yeah.
I promise this will be my last one. I got to apologize.
Please, no.
Okay, David.
Yeah. I think you're preaching to the choir on this.
Yeah.
My follow-up question would be, what, as a public official, what can other public officials like you in Whatcom County and Skagit County and other counties, what can you do to talk some common sense into Rick Larson and others, public officials, state officials? Is that part of your job as protecting the public health of this county, that you can go do that, you can speak up and
Complicated question, let me have a crack at it. Okay, so I personally have worked for Rick Larson's getting elected. I've donated money to him. And what I can tell you is that he won't talk to me. Okay? And it's really easy because you just go to the public disclosure website and you look and you see that in a non-election year, the railroads and the shipping terminal companies put about $200,000 in his re-election campaign, in a non-election year. And it costs about $500,000 to put a viable candidate on the map to oppose that level of position. And these folks are willing to put up the money it takes. And he will not even talk to anybody about coal, period. He won't do it.
wow.
So can I do something as an individual? I'm trying to do that. Now, the other question you asked, though, is really about can we as officials. And what I want to tell you is that you have a great, we have a board of health here. So we have the county commissioners you all know about. We also have a board of health. And that board of health is composed of our county commissioners, plus it has been eminent nurses. It happens now to be eminent doctors. It kind of fluctuates. We're strong on doctors. Before, all we had was nurses. But we have really wonderful medical people on that board. John Guyman was one of them. And our Board of Health last year, more than a year ago, supported getting a health impact assessment done at a policy level. People in this community have donated money, some significant money, to get that kind of study done. We've worked very hard to get a health impact assessment as part of the environmental impact process. So the county and other groups in San Juan County, the county itself and other groups in San Juan County, and your Board of Health and me have all worked hard to try to get that done. Because I think if they include a health impact assessment, it will show that there are impacts that are significant. And what the people proposing this know, they've done all their focus groups and all their research about what will work and won't work. And what they know is if the debate is between jobs and the environment, jobs always wins. And what they also know is if it's people's health versus corporations making money, that the health always wins. So whenever there's a debate or discussion about this, and I bring up health, they do not want to talk about it. They will do anything to reframe the issue as jobs. And they're very skilled and highly trained. So they always steer it back there. And so we have to be as skilled in getting the health issue front and center. To date, and I know because I was in a meeting about it yesterday, they have succeeded in suppressing the content of the scope of work for the EIS. You and I and nobody can get access to it. And so we don't know what's going to be in it. The people I talked to on the inside that were willing to talk some did share that it's not going to meet the international standards for a health impact assessment, because you have to do scoping, you have to get all the new parties together that are affected, and there's a whole process you go through to do it properly. They're not going to do that. So I know they're going to miss the mark on doing a proper health assessment. And because of the way all the laws are structured, that probably isn't going to be a deal breaker. They'll do whatever they can get away with. Now these are, SSA Marine is the largest owner and private operator of ports in the world. It's interesting, the owners are from Bellingham. So they started in Bellingham. And then they expanded and expanded and expanded globally. But, you know, these are not inconsequential people. Burlington Northern Santa Fe, SSA Marine, these are very substantial people. And the funders, before Goldman Sachs and now the gentleman from Mexico, are who you're dealing with. So we need to do everything we can. We need to have an objective, independent health impact assessment. And the thing that I love to say it in front of Craig Cole, their spokesperson, is I say, people will die because of this. And he gets up and rants and raves and tries to make light of it. But people will die because of it. And they can't have that said in public. They will do anything to distract. They will act like idiots. It's kind of fun. I do it now just for fun. Because it just keeps bounces out his chair and waves his arm and says, look over there, look over there. It's just kind of fun once you get angry. But so people are working as hard as they can. The deck is stacked against you, honestly. And I think we need to do whatever we can do. Yes, sir.
I do want to see more of you.
Yeah, I was just thinking, maybe if you hold your question for a second, let me just talk, because we're almost done. So the three main organs of your lungs, your heart, and your brain are what are impacted, and we know a lot about it. Respiratory health and oxidative stress, asthma exacerbation, asthma increases asthma development, exacerbations, chronic COPD is increased, stunning of lung development in kids, infant mortality goes up, and lung cancer goes up. There's scientific, objective articles published about all those that show that happens. Cardiovascular effects, increased heart attacks, and they understand now actually the molecular basis for it. They know exactly how diesel particulate matter gets in your lung and all the reactions it causes to make increased heart disease, arrhythmias, infarctions, congestive heart failure. And it also works through your vessels to cause ischemic stroke, cerebrovascular disease, and loss of intellectual capacity. All those things, there's medical literature that shows that those occur. So now, let's take your question. Sir?
Well, two things. One is just a comment for David. It is in your power to do something about it as chair of the local Democratic Party. Let's not endorse Larson for re-election this time, okay?
I'm not chair.
Not yet.
This is a nonpartisan discussion. You
Yes.
might want to keep it that way.
Yes, ma'am.
Are you prepared to give any comment about the effect on our health of the Catholic control, the bishop's control of our hospital?
There's a shift in course. What's happening right now is interesting because the last couple of contracts that the Peace Health System has signed have actually had a structure that separated the church agreement from the others, so that the institutions who sign those agreements don't have to fall under that control. I think they realize that if they're going to grow and change, they can't. They have to find a legal way to separate those things. So there's actually a move afoot to do that right now. But that's more lawyer stuff than doctor stuff. But I think it's important to have the full access to the full range of services in any community. So,
Is
yeah.
it too late for our contract to change?
Well, it's interesting. People complain about the hospital all the time to me. And they want to bring the issue to the Board of Health because it's a kind of a sympathetic place to listen to it. There is a hospital district here that has a contract and pays over, I think it's $2 million and some dollars a year. And they're elected, and they should be responsive, and they should be interested in those concerns. And if they're not as responsive as you like, you can engage in a political activity and replace them, which is what I would recommend if that's your concern, that you consider doing. It's democracy. I mean, for years, we've had a hospital district for a very long time, and it taxes you. It takes everybody's money. It's a democratic institution. If it's not doing what you want it to do, I shouldn't tell them we go and vote this. Get out there and do it. Yeah.
It sounds as though things are sort of fine with our teenagers. You know, we don't have these big high statistics. However, that doesn't mean it's not an issue. And I'm wondering how you feel about what our teens are doing and drinking and teen pregnancy and ability to get help.
Well, the big things I'm really worried about is we made policy drives a lot health way more than people assume that it does. And we made two decisions in our state recently that I think will have a significant impact. One is allowing alcohol to be sold anywhere, hard alcohol. Data will show, I'm predicting, that that's not a wise choice. I think many people said that at the time, but that's what the law is. So I think there's going to be more access to alcohol than there was before, and there was already a lot of access to alcohol. The second thing is the legalization of marijuana. And kids are going to have greater access to that drug. And people have all kinds of opinions about it. What I can tell you is from a scientific point of view, about 10% of people get an amotivational syndrome where they just don't kind of do what they intended to do. And 10% is a big number. So I think there are certainly going to be more kids having access to marijuana. Not that they can buy it, but it's going to be in the home, it's going to be on the streets, it's going to be all over the place. It's certainly not any cheaper. I think it's going to be considerably more expensive. But it's going to be more accessible and more people will experiment with it. More adults are going to. So I think those are two policy level changes that I don't think are very friendly in terms of health status. In addition, I think the big issues here, I have always been shocked by the difference between teenagers here and even on the mainland. Sexual activity is more substantial in an earlier age. There is significant alcohol and drug use already. There is a certain amount of isolationism. There certainly bullying and that sort of thing takes place in significant ways. There's a bunch of issues. One of the processes we had when we had the money to do it was we had a death review process for every single person under 18 and under that died. We reviewed the case. And the prosecutor and the social service agency, we got together actually in this room and reviewed every single case. Not to put guilt or blame about that case, but to see what structural change we could make to make that death less likely in the future. And that was a very, very valuable process. And I was sad to lose that process. Because in doing that, you can try to figure out, and maybe there's nothing you can do to change it, but suicides happen, motor vehicle crashes happen, and those are things you can make structural changes to make them less likely.
And what about heroin now?
It's interesting you say that because working with tribes, well, let me just go back and start. So heroin used to be a pretty big problem here and in other places, you know. And then OxyContin came along. And OxyContin was just a great drug. It was going to solve all pain problems, right? And I'll never forget, because I ran an interfaith clinic, which is a large community clinic that I founded in Bellingham, and got hundreds and hundreds of people off narcotics, because just poor people were more likely to use. And I remember, I've been away for several years, I was gone to Asia quite a bit, and I came back, and a bunch of the people that I'd gotten off heroin were now on OxyContin, put on them by the doctors. And I could have wrung their necks, I mean, honestly. And so the people manufacturing OxyContin lied about it. They had data that showed it was more addicting, and they didn't disclose that, and they lost a court case, and they got fined millions of dollars. They'd already made billions of dollars, so they wouldn't mind. Then they also, they've done a couple things to change it. One, they've really restricted physicians that overprescribe get identified and lose their license much more readily. That's changed. And they've changed the pills so they're hard to crush, so you can't snort it or smoke it or whatever very easily. So OxyContin has fallen out of favor, and it was about $1 a milligram. So the 80 milligram tablet, $80. So there have been several things, though, that really pushed the availability of OxyContin as a recreational drug much, much lower on the totem pole. In the meantime, heroin, because there wasn't much demand for it, the price hit the bottom. So you'd be shocked, but it's about $15 to get high on heroin. And there are places where it's 6 or 8 or 10. So $15. It's way cheaper than anything else. It's become very popular, and having worked with a lot of drug users, you find out more than you want to know. The way that heroin gets here comes from Mexico, it comes up to Yakima area, and then it comes over to Mount Vernon, and then it goes down to the big cities. It doesn't start in the big cities. So the main entry point for heroin in this region is the Mount Vernon area. And it typically comes in through a combination of Hispanic folks bringing it up from Mexico and tribal people. Tribal people, because on reservations, only the federal law applies, and state and county and local laws often don't apply, that there's a certain amount of difficulty in holding people accountable. I mean, I'd known about a drug dealer on the Nooksack Reservation and tried to get the tribe to act on it, and they couldn't because they didn't think they had the legal authority to do it. And I tried to get the sheriff to act on it, and they didn't because they didn't think they had the legal authority, because of the confusion about who actually has the responsibility. And it turned out that the people who did have legal authority were the BIA and the FBI, neither of who have staff in the area. So that's kind of how it prospers and thrives, and given the price that it's achieved now, the use is going through the ceiling. And unfortunately, one of the good things about OxyContin was you don't get HIV, and you don't get hepatitis C, and you don't get hepatitis B because you aren't shooting needles. With heroin, they're shooting needles. And there's a whole bunch of diseases that come with that. It's not just the addiction. Yes, sir.
This is a non-political question. Don't
Thank you, Tom.
Back when my late wife Wilma was looking at the problem, she found that San Juan County had the highest breast cancer rate in the state. Has that changed any, Dr. James?
Well, you know, when I first came to Whatcom County, I looked at the breast cancer rate there, and there are people who were drinking water directly out of Lake Whatcom. And it turns out, without it going, not through the city, but they were doing direct withdrawals. And the breast cancer rate was higher around the lake. And I thought, oh man. But then I standardized it for age. And it turns out to live near the lake, you have to be rich. And to be rich, most people, you have to be older. And so when you standardize for age, that finding went away entirely. So if you compared people of the same age, the rate was the same. And here in our county, we have a higher rate, but we have an older population. And so you can't just look at the absolute rate.
I know it has to be age adjusted.
Yeah, it has to be age adjusted. And so, could there be, I mean, The in-migration, out-migration issue, is it real? You know, what exposures are there? What I can tell you is that there's some very well-known exposures. For example, if a mom is exposed to tobacco, smoking, a secondhand smoke, she doesn't have to smoke, just her husband has to smoke in the house, and she's carrying a female fetus, that fetus's risk of breast cancer goes majorly up. So there are lots of things that affect it. And we have a low smoking rate. We have very few environmental, I mean, it's hard for me to get a handle on why is there something we can do about that. We did have, in the slide I didn't show you, was we had a lower rate of mammography here than the rest of the state. And that early detection has two effects. One, it increases the rate because you find more. And two, it increases the cure rate as well. So I think one great thing about the hospital here is they've got the highest, the best, newest technology for mammography, and having that really available community is a big step forward. And the old kind of mammography probably causes many cancers. Is it prevented? Is it cured? And then we're about the 4th generation up, and the new ones have, you know, almost no radiation at all. They're very, very safe. And that's what's available here, is the newest, best, safest. Yes, ma'am.
I'm wondering, is it known how dangerous the effect is of smoking marijuana as in smoking tobacco? I mean, we hear a lot about the dangers of smoking tobacco, and I keep thinking, well, we're all going to be smoking marijuana, so, I mean, right, you know, well, no, I'm not speaking for anybody in this room, I'm just speaking for the nation, all right.
But the state at least doesn't
What
cover
about
it.
the smoking? All I want to know is if they're
Well-
inhaling stuff into their lungs, is marijuana as dangerous as tobacco? Is it known?
Yeah, there's data about that. And basically, for the same level of exposure, marijuana causes more damage in your lungs. But people, if you smoke 12 joints like cigarettes, most people would be standing here staring at the wall. They wouldn't be able to go around and find the next one. You'd wonder where it was at. So I think even though per unit dose is probably more harmful, and then people didn't used to believe that, but now we're looking at it very carefully now it's being legalized. And so I think there's reasonable evidence that it's actually probably more harmful per unit dose, but realistically probably people have less exposure because of fewer exposures. Yeah.
Related to that, and I apologize, that was my next to the last question. I read in a book recently, and this will give you an idea what kind of books I read, that there's no evidence of anybody ever having died from an overdose of marijuana as opposed to all the other drugs that you frequently read about people dying from. Could that be true?
That's probably true. I mean, I don't know of any, I've heard that quoted, and clinically in medicine, I've seen people die from many things, and I haven't seen them die from that. So I think that's probably true. People get torpid, I think is one of the words. But to say that is oversimplifying, though. As a young man, one of the reasons I stayed away from drugs is my first college roommate went home to visit his brother in Seattle, and he didn't come back. And pretty soon, about 3 days after he hadn't come back, I called the dean and says, what's up? He hasn't come back. I'm worried. And he was in the hospital. He'd been shot through his lung, and his brother had been shot and killed. And it turned out his brother was selling marijuana. And he was robbed, and the brother was shot and killed, and he got shot through his lung. He turned out to be okay. But it's a great lesson for me. It's like, it's not because, it's you hang out with people doing that stuff, you get in serious trouble. Our state health officer, Maxine Hayes, who's a lovely person, her son was killed in a drive-by shooting in Seattle. She had nothing to do with it. So maybe decriminalizing will make that safer. You'd like to think that.
Well, there's all the other things, the driving and everything else.
Maybe it won't, I don't know, yeah. But on the relative scale of what people die from, it's not going to make the list. Yeah. On the dysfunctional side, though, that 10% of people who get innovational syndrome, that's a real thing. And they're not going to die, but they can become, just not pursue the things and the potential that they have. And I think what we're going to end up doing is trying to figure out how do we identify those people, how do we help them. Marijuana is not addicting in the same tobacco is Tobacco is physically addictive. You go through withdrawal if you try to stop. And that doesn't appear to be the case for marijuana. So it'll be interesting. I think we don't know, and it's a grand experiment.
The 10% figure, what is it with alcohol? I mean, it's got to be something significant also with alcohol.
I don't know of an amyloidational syndrome. There's lots of
Well,
alcohol.
dysfunctional syndrome.
Alcohol kills your brain. Yeah, it makes you. It causes dementia in people. I mean, there's a lot of excess consumption of alcohol, more than one drink a day, and you're looking at serious, very, very serious implications. I mean, under 65 years of age, the leading cause of death up until you're 65 is motor vehicle crashes, and at least 60% of those are alcohol related. So in terms of impacts, alcohol has a tremendous impact on morbidity and mortality in our country. Now, over 65, the math changed, but under 65, and most people think of those as their good years up until 65, the leading reason to die is alcohol related. So that's, if you want to make a case against alcohol, I'm here to help you. I think we really don't know what the deal is about marijuana. One of the reasons the feds are letting us do this, because it's still illegal on the federal books, is they want to see if it can be done and not be crazy before they let it out of the box. That's my take on it. Way in the back.
I withdraw my question. You answered it. Thank you.
Okay. Yes, ma'am.
So I feel like we, as a county, have a high cancer rate, but it doesn't sound like that's the case. I think we have a pretty low average.
Yeah, every place and anybody I ever talked to thinks they have a high cancer rate. and the details really matter, and you have to, if there are systematic things that can be done, we need to do them. But honestly, I don't know why cigarettes are legal to sell. They kill 450,000 people in America. Take it to the bank data about it. It kills people. It's physically addicting. You have to go through withdrawal to stop. It's insane what we do with tobacco. So if you want to talk about cancer, that would be a good place to start. Because the data is absolutely ironclad. There's no mystery at all. And why we allow it to be so is about politics and economics. It's not about science and reason. Because science and reason says it's idiocy. Yes, sir.
The people that are for the terminal in Cherry Point,
Yeah.
they talk essentially about job creation. And that's pretty much all they talk about. And then they use all their money to purchase whatever level of
Legislative support they need.
Yeah, thank you. On our side, as I listen to different people talking, I'm not in favor of Cherry Point, talk about it, it seems to get fairly scattered in terms of, save the whales, marine accidents, et cetera, et cetera. But it sounds like what you're saying is the scientifically supportable position to take is one that says, here are the health hazards that are proven that are going to happen if you let this happen. And it's not a question of maybe it would or maybe it wouldn't, but it's scientifically proven that it will.
It's definitely scientifically proven that it will. What we don't know is how many.
Yeah.
What you need to do, what a health impact assessment would do is take all that scientific data we have and apply it to a particular population. Because if you did that, you could calculate what the range number of deaths in every one of those categories is going to be. And the cost. So that can be done. And they desperately don't want to do that math. So the jobs question is interesting. There was a study done by the Rockefeller Family Foundation that actually concluded that there would be fewer jobs in Whatcom County because of the coal terminal, because of the impacts on the other economic drivers in the community, particularly the redevelopment of the waterfront, that in fact there would be a significant net loss of jobs. It's all probabilistic, but most probable there would be a significant net loss of jobs. It's interesting working with the unions too, because they were very smart, the people who came in and did this. I learned from this, and then I went up to BC and we did it the other way around up there. But they got to every local government ahead of time. They got to the unions ahead of time and got them on side. And once people commit, it's hard to get them to change. It's much harder to get them to change than it is to get them in the first place. And they beat us to everybody. In Canada, it's the other way around. Every single city in the Lower Mainland has passed a resolution against the coal port or asking for health impact assessment reports approved. All of them. The city of Vancouver went one step further and rezoned the entire city so you couldn't build a coal port there. That's pretty clever. Yeah. But, you know, those impacts, I think, those immediate health impacts are largely related to the trains and the storage facilities. I think they're not the issues here. I think the big issues here are the safety of the ships, the dramatic financial impacts and environmental impacts of one of those ships crashing, because that's a real risk. And of course, then there are the marine mammal issues. I think we're uniquely suited to talk about. I mean, those impacts could be great both in terms of our own economy, that is, if whales disappeared, that would definitely hit the economy, but also just respect for the beings that are there. And some countries actually, things like dolphins have rights. They're non-human beings that have civil rights. Sort of an interesting concept. Well, I appreciate your time. I have more time. I'm here till 2 if you want to come.
Well, there was a health impact assessment that was suggested that people donate to support in Whatcom County.
Yeah.
What is the status of that? And if it is done, can that be used in the scoping?
Yeah. When we first started looking at health index assessments, the cost of doing was about $500,000. And we got together about $125,000. And so we have to be selective of what's going to be done. And so there are 3 institutions. There's Washington State University, University of Washington, and there's a public health research institute in Oregon that have taken on the responsibility for doing it. And with the funds they've got, they're going to be able to address 3, what they believe are the pivotal issues that will make a difference. EISs don't have to look at existing data. They can never be forced to do studies. They can only be forced to interpret current data. And so what they're focusing on is doing studies in critical areas that will provide the information in the EIS, so they will have that data when they come to their analysis. So that is ongoing right now.
And what were
they're the coal dust issue and quantifying the amount and the distance and all the science behind what the actual exposures will be. I can get that to you.
Okay.
It's actually just being solidified right now, because there's some disagreement about what the 3 should be. There's actually 4, and enough money to do 3. So it's trying to figure out what to do with that right now. Yes, ma'am.
My single question is now 2, and piggybacking on Ann's, is there still time to get more money to expand the research that's being done?
Sure. Last night I was talking before the Whatcom County Council, and so they were supposed to have started the CIS like a year ago, and they haven't done that. And they're different. What they tell you is they just start reviewing data or something. In fact, what's happened is the price of coal has gone from $130 a ton to $70 a ton. And in order for them to make money, it has to be $80 a ton. And the companies that were exporting coal to China last year lost money. Okay? So what they're actually doing, in my interpretation, is they're waiting to see if the price is going to rebound in China. It's that simple. And at this point, they've paid hundreds of thousands of dollars, not yet millions of dollars for the EIS. And the next check is due. They can't start the EIS proper. They paid for everything up to starting the EIS. They haven't written that check. And until they do, the process is going to start. So it'll be interesting. In the next few weeks, they're either going to write the check and believe the price is going to rebound or not.
From what we hear, though, even China is beginning to close down its old coal plants.
Yeah, China is, like I say, they're really in a bind because they have a much worse situation than we have. And eventually the population will revolt. And they have experience with that. So, how that works out is going to be hard to say. But yeah, the biggest thing is what they did is there used to be tax advantages for coal importing facilities. And China internally has removed those tax advantages to give some more viability to their own coal industry. It costs them about $185 a ton to get their coal to the same place that we do. The reason for that is we have these machines that are sort of the size of this building harvesting coal, and they're still able to pick and shovel. So, and the we've mechanized it so people are almost not involved, or very few people involved. And so their price is higher. And they've changed that structure to give some advantage internally. And that's probably the single most important thing. Seemingly irrelevant to us, huh? But that may be what makes the biggest difference in whether or not it goes forward.
My other question was completely removed from what has come before. Since you oversee our water here in the islands, do you see the fact that we don't have a comprehensive water assessment of this county as a problem, given all the pressure that there is to help the building industry rebound and to encourage tourism when we have a finite amount of water? What is your assessment of our water situation?
As Mark Twain said, whiskey's for drinking, water's for fighting over.
We do that well here in the
Yeah, no, everybody does. I can tell you, but when neighbors don't like each other, they sue each other about water, and I end up being involved, and I hate it every time. I start out liking all the people and end up not liking very many of them, because it's used as a tool way too often. But the bottom line is that from one point of view, we have 12,000 lots already platted, too many for the amount of water that's here. So from one point of view, depending on what assumptions you make and all, we already have overshot substantially our water resources county. Now, that's not our current policy. And there is no effort to look at it systematically. I think it's one of the most important things we can look at systematically. I think we definitely should be stepping back and doing an assessment of the entire county, ruthlessly, objectively, independently, and have that inform our policymakers. Because once it comes down to a particular project or a particular home or something like that, there's tremendous pressure to build the building, to do the work. But I think, I don't see any rosy things about water at all in our future. I see the saltwater treaty is going to become more of a problem, not less of a problem. Rainfall may or may not become more abundant, and may become less abundant. And that recharges a fair number of our aquifers. Like I say, I think from one point of view, there's already more platted lots than there's water anyway. And efficiency is really one of the biggest source for water. I mean, we waste water tremendously. I mean, we're better in San Juan probably than the state, and we still waste money. You know, there are certainly homes that you can run a home on 50 gallons a day. There's one home around 12 gallons a day. And most people up to 300-400 on the low end. And there are a bunch of state laws that are really complicated because you can drill wells almost anywhere. It's for single, just your own use. The biggest thing I see in terms of practical effects that the health department's involved in is people want to drill a well, and because they don't have the setback, they have to get an easement from their neighbor, and the neighbor doesn't give them an easement. And then everybody starts suing each other. Or they want us to waive the rules so that they can do something that's the general rule book wouldn't let them do it. More than you want to know about water. That's a whole other topic.
This is really important because this has been a question that has come up over time in various of our discussions. And thank you for addressing it.
Well, water is going to be, in terms of the development issue, it's going to be the rate limiting thing for what can happen here. And then how we work that out is big politics, big economics, big fights.
And we hate to cut you off, but we have to have the chairs put away and out of here. Thank you so much.
We've been here for 21 years last December, and it's been, and I didn't want to do it when I first came out here, and I wouldn't give it up to anything.
So you might come back if we were to invite you.
Okay, who knows when these chairs go?